In this video, I'm going to look at bone bruising, what symptoms you get, how it affects your recovery, and what you can do about it. Now, other names for bone bruising is edema, bone marrow edema, contusion of the bone. But the important bit is that this video is about bone bruises associated with activity or sport or trauma. It's not for bone bruises associated with osteoarthritis or osteoporosis. Those type of bruises are caused through different processes, and the advice in this video does not apply to them. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment for your injuries, all done via video call. Have a look at the description of this video if you want a link to our website. So what's a bone bruise? Well, it's exactly the same as a type of bruise that you would get on your skin, except this is now in the bone. So it's an area that took impact and now there's some blood accumulated in that area and extra fluid, and you can get pain and swelling there inside the bone. Now, the most common cause is obviously trauma. So it's anything where you've had a sudden twist or impact on a joint. The most common joints you can get it in for is the knee and the ankle joint. So you think of typical ankle sprain can cause a bone bruise. If you injure your ACL, your anterior cruciate ligament, that usually involves a sharp twist of the knee, and that causes bone bruises quite commonly. Also the MCL that you injure, that can cause a bone bruise. But you can also get it without impact. So there's evidence that people who do different types of sports, like running, for instance, in marathon trainers, you can see bone bruises. But interestingly enough, the bone bruises can also improve despite the fact that they do marathon training. So it doesn't mean that everybody who does that will get injuries there. And the reason they think it develops in repetitive sports is if you run in a certain way, so your biomechanics is that you keep on having impact on a certain part of the knee or the ankle or something, or it can be the terrain you train on that suddenly causes more impact on the bones in a certain area if you think of sharp cambers. So that could impact it and cause a bone bruise. So the interesting thing with bone bruises is that they don't always cause symptoms. You may not even know that you have a bone bruise a lot of the time. There's research to show that when they scanned athletes before and after a season, many of them had bone bruises and they didn't actually complain of any symptoms in those joints. But for some cases, a bone bruise may cause pain, and there's some research in ACL recovery that sometimes it can delay how quickly you can get your knee straight because it can cause more pain on extension movements. But again, not for all, and they're not quite clear yet if there's a specific volume of bone bruise or area that has more impact than others. The good news is that it doesn't seem to impact long-term recovery. So even if you have an extensive bone bruise in your knee, it doesn't mean that your recovery, when you look at it a couple of years from now after your ACL injury, is going to be worse than somebody else who didn't have a bone bruise. The only time that bone bruises seem to affect the long-term outcome of an injury is if it's associated with a cartilage injury as well. So how do you treat a bone bruise? Well, first of all, you don't really have to do anything specific or special for it. It's just the common sense things that we do for rehab in any case. And the first step is that you just don't force the movement. If it hurts to extend your knee fully, you work in the pain-free range and you gently and politely get it to move through the range you want it to do. Don't push into pain, don't make your pain worse, and respect it. You wouldn't be pushing on a bruise that you have on your arm the whole time and expect it to get better. So you just want to remove that extra pressure for a while, but as it improves, you can carry on with it. Also, it doesn't mean that you don't do anything, because remember, bone bruises mostly happens inside the joint, and joints don't have arteries or veins going in and out of them. They actually need movement to get fluid and nutrients in and out. So you need the movement to help the bruise recovery. And that's why it's important to do your rehab and do activities as much as you can, but just respect the pain levels. So what about impact sports? There's a line of thought that people should avoid impact sports until their bone bruise has recovered. But to be honest, there's no evidence to back that up, and clinicians seem to be divided with regards to that. From what I've read, I think you should just be using your common sense and looking at your symptoms, because there's evidence from marathon runners that actually in the one study they looked at before they started marathon training, whether they had any bone bruises or anything visible. And then they looked at how it reacted to marathon training. And what they found is that some of the marathon athletes, actually their bone bruises improved despite the fact that they were doing marathon training. Others got bone bruises that they didn't have, but then 6 months later, in a different study, they had already recovered. Some of them didn't recover. So the impact from the running doesn't seem to be the sole factor for a bone bruise to recover or not recover, or to get a bone bruise or not to get it. It seems there are other factors involved, and it may be things like the terrain you train on, whether you constantly go into positions where the bones are going to be compressed more, so it may be your running form, it may be the shoes you run on, it may even be in those cases, because they didn't monitor it that well, it may be that people had a twist that they didn't even remember that they twisted their knee or something while they were running, and that actually caused the bone bruise rather than the running. So I don't feel there's enough evidence from the research to show that impact sports is necessarily bad for bone bruises, but if they do cause you symptoms, I would stay away from them, and I would go for lower impact things or any activities that doesn't cause you symptoms. So I guess treatment advice wise, I can nail it down or bring it down to two things. One, do whatever you want to do as long as it doesn't cause your pain. And two, don't just sit still, do move, because movement is important for recovery. Brilliant. Hope you found that useful. Now remember, if you need more help with an injury, you're welcome to consult one of the team via video call. The link to the website is in the description of this video. Take care.